Welcome back to TMI with Terrell and Martha. We're so glad to have you back here. If you're watching us on YouTube, please like and subscribe. That's how we get to know what you like and subscribe. And also, we want you to put comments in, things you'd like to hear about. So we really want you to be a part of this endeavor. Today, Terrell, we got somebody really exciting we're going to talk to.
Yes, Martha, I'm very excited to introduce Dr. Brian Gay. He is in the local area, and he has opened up something that I feel is very important to health and wellness. And so I invited Dr. Gay onto our show to talk to our audience about his new practice and where his background. So
thanks for having me.
Yeah, why don't you go ahead and kind of mention a little bit about your background and what you're up to.
Well, thank you again for having me on the show. It's exciting to see you both, and what a great husband you got.
Thank you. Thank you very much. I think so too.
Shout out to him. Hey.
Almost every day.
Yeah, well, he should have a seat at the table.
We talk about him a lot.
Exactly
That's right.
Yeah,
Seriously,
we talk about him a lot. He's a good guy.
Well, anyway, thank you so much for having me on here. And so I own a company called First Look MRI, and we provide MRI scans with no contrast. So MRI scans at an affordable price here in Gainesville. And before that, I was an MRI specialist at the hospital, Northeast Georgia Health System. I was the first MRI specialist. I was there for several years. Eventually got the courage to break away and start my own practice. And after several years, I opened up First Look MRI, which does MRI scans. So people like you can just come in off the street and get a scan. There's no need to have a doctor's order because we don't take insurance. So you can just come in and get a scan of your brain or your knee or whatever.
I love that.
And people have a lot of times kids will come in who have like a soccer injury, or they have a track meet the next day and their leg is killing them. They don't know if they should compete or not compete or how bad it is. And they'll just come in, get the scan. The cost is $499. And so it's like direct radiology right to the patient. And sometimes doctors order too. Maybe half our patients or 3/4 are ordered by doctors, but a healthy percentage are just people who have headaches and they want to know, or they have a shoulder pain and their insurance denied it and they just want to know, do they have a labral tear or rotator cuff tear? So it's been kind of an exciting thing to do, and to deal right with patients is kind of fun.
So I'm so glad you brought that up about how you can just come in, because when we had the ice a couple of weeks ago, I fell on the ice, hurt my arm.
I fell on the ice too.
Yeah, hurt my arm.
You did
this year. I did
one
not.
One person didn't fall on the ice, but everybody else did.
And I went in the next day. I talked to Dr. Vaxvanis and went in the next day. Yes, went into
our favorite people, Dr. Vaxvanis. So shout out to her. Yeah, she's wonderful. And the husband's not too bad either.
Well, that's who I went to see.
Oh, okay,
it's so funny.
John's great too.
I talked to Sherry, and then Sherry got John to answer me back, and he said, come in tomorrow at 7:45. So I got an x-ray. Everything was fine. But while I was in the waiting room, there was this young lady who was an athlete in there with her dad, and I heard her dad saying to her, yeah, we got to do the x-ray first, even though we know what we need is an MRI,
right?
Because the insurance won't let you do it if you don't do the x-ray first.
Yeah.
I see it is a waste of money typically, because you're not going to have a displaced fracture. And it's just it doesn't see a bone bruise. Yeah, it's just a waste.
Yeah, absolutely.
But it's the way of the world right now. Basically.
Yeah, I mean, I think it's so crazy, and I don't want to get too much into the insurance world, but my father-in-law gets injections every 3 months for his knee. He's not a surgery candidate. He's 93 years old, and he has some heart problems, so he's not a surgery candidate. So we have to take him in. And because the new year flipped over, even though he's been getting these shots, he has to come in for a screen test where he doesn't get a shot, okay? And then come back. So I got to bring a 93-year-old guy
in and out
to a thing to approve from Medicare.
That's
and then
amazing.
Bring him back again. It's just so inefficient.
Well, it's not patient-centered.
Yeah.
We've
Patients have lost control, completely lost control.
We have lost the ability to control our own health.
Yeah. Third-party payer systems and the insurance companies, both of those have really undermined our health. Yeah.
We'll talk more about the MRIs, but I love this experience because everybody always kind of looks at radiologists as having the great gig because they're hospital-based. You don't have that much overhead.
You don't room, you don't talk to anybody.
That and you don't have overhead usually, and you don't have. It's a little different. But you got to a point where you said, "I need to do this differently."
Yeah. That's exactly right. So radiology is a very good gig because you're right. You don't have the overhead. You sit in a quiet room and you read as fast as you can. You don't ever see patients or hear from them.
Right.
And some places don't even want you to talk to the patients.
And you
They're
don't
like,
even know
"Stay
the
away."
patient.
Yeah.
Yeah.
So it's a weird feel, but it's not very good for my personality. I really love people and talking to people and engaging. But as a radiologist, in the olden days, you used to be able to talk to the doctor. So let's say your husband would come down to look at a CT scan. I'd put it up and we'd talk. And so
You'd interact
we
with each
interacted
other.
a lot.
Yes.
Radiologists used to be a fairly social thing back in the
Yeah.
olden days, you know,
Yes.
Park Hospital. And then everything went digital. When things went digital, radiologists just completely disappeared. You no longer
They
had a
put you in
reading
the
room.
hole.
Yeah. And you just read as fast as you could in a dark room, and that was life. And anyway, so I got to the point where I just wanted to do something different and be creative. And
You have done that.
and also it really bothered me the idea that patients didn't have control of their own health. Like every year it got worse and
Right.
worse.
Yes.
And things are expensive and everything's so confusing. If you wanted to, let's say if you wanted to you had headaches, you wanted to get an MRI of your brain, you had to ask permission from a doctor to get the order to begin with. And then on top of that, you have to ask your insurance company, and they always say no nowadays.
Right. Oh, no.
And so you're like, wait a minute, I want to find
impossible.
out if I have a headache and I'm not allowed to. I can go buy a car, I
Right.
can buy a jet, I can fly to Europe, I can do anything, but I can't get information on my own health. It's all tied down, with the insurance.
I wanna look at my own
kinda actually
body.
That's right.
angry at our system, and I was like,
Yeah.
what can I do? I'm just this like person working in a dark room over here. What can I possibly do? And I thought, wait a minute, I'm a radiologist. I could buy a scanner and I could just open it up where people don't even have to have insurance. They can come in off the street.
Right.
No one can say no. They can find out that day with no headaches or complication. Just keep
No.
it super simple. So I opened it up and then kind of held on for years and years trying to make it work.
Yes. And I know it's not like an easy process to build a
Yeah, very
business
expensive,
of
yeah.
that nature. First of all, a lot of people still aren't aware that
Yeah.
you're doing that, which
Well,
is
it's such
why
a
I wanted
new,
you
strange
here.
thing. Yeah.
And I mean, everybody says it. I wish I could just go get an MRI. Why am I having to jump through all these hoops? So that is a clear problem, is just, not
Yeah,
knowing.
knowing that it's available. Yeah.
Right. And, some people just even with a discounted cash pay can't afford it, but there's a huge range of people that can and should do it. And, I don't think there's any real, coming from a wellness perspective, we're always concerned about radiation.
Right.
And so I think MRI is one of the safest.
Yeah, well, is the safest. So MRI, unlike other things, well, ultrasound is safe.
Right,
And
right.
MRI in the same way is very safe. There's no ionizing radiation. So when you have a scan, it's almost like taking a photograph. So you can take a picture of you
Right.
in different angles. There's no harm being done. So MRI scan works with magnets and electromagnetic waves, which are out in this room right now, radio waves.
Yeah.
And so it's just safe and harmless. You could have a scan.
Yeah, I
all
love
day
those
long
whirring
and every
magnets.
day. Yeah. It's just loud. Yeah.
You are unique.
Yeah,
in
I
that.
like the magnets.
Yeah,
A
I
lot of
do.
people they fall asleep.
Yeah.
She
They're like,
loves
it's
it. She
comfortable.
said, "Oh yeah, I
So-
love it."
White noise.
Not
So-
everyone wants to be there, but
So let me ask you. So someone comes into your practice, they and it's called the practice of medicine, folks, because everybody's different.
Yeah.
Okay, you
That's
have
true.
parameters that you try to fill, and people fall within. But there are people that don't
Yeah,
fall within the parameters.
absolutely.
So, what is there? Because I'd be worried about people like getting hooked on it, like every little thing they have, they
Over
want to come in and
MRI.
get a new one. So, like if you have one, like say you have a full body scan, would you need to do it every year? Should you do it every year?
That is undetermined, actually. That's a big question. A lot of people do it every year just as part of their general health and well-being.
Yeah.
Just that they get their physical every year, then they go get their blood work every year, they'll get their colonoscopy at the appropriate times. And the question is, when should you get the MRI scan? Some people come every year just for peace of mind. They have the
Mhm.
money and they're like, you know what? I want to do everything I can for my health and I want to find something
Just get a jump
early.
on
And
it.
so every January or whenever their birthday, they come in and get their scan. But that may be overkill, and I don't think there's any right answer.
Well, there's probably no one size fits all, but it is a snapshot, right?
Yes.
So the human body is very unique. It changes on a regular basis from one day to the next. You got a lot of things going. So, the MRI, people have to have their brains wrapped around what its best use is for, right? And it is a snapshot in time.
Yeah.
So you don't just go in and get an MRI and
And
never
done forever,
worry
yeah.
again
You just
about
have the peace of mind knowing, hey, today I don't have a pancreatic
Yeah.
tumor. I don't have a
Yes.
renal tumor. My mom had like a stroke. I don't have any white
Right.
matter
So
disease
my
in my
odds are
brain. Yeah.
better than
or my
now
carotid
that,
arteries
yeah.
are wide open. I'm good today. And now next year at this time, could I have a new pancreatic tumor that's very small? Could I have a new renal lesion? And the chances may be very unlikely.
Right.
But I think about the physical exam. My wife's primary care physician, and of course I
Yep.
went to medical school. And the physical exam that you get every year is very poor. You push on the abdomen,
Yeah.
really can't
Yeah.
feel anything. It's just almost useless. But MRI is unbelievably powerful. You see everything in the abdomen.
And they're great now, right?
Yeah,
they're so good now.
They're
No,
beautiful
I'll show you
quality.
mine.
Yes, it's really incredible.
It's
to have that kind of
amazing.
detail is just remarkable. So
Yeah.
the problem is it's just so expensive. So instead of doing the physical, we should be doing the MRI scan because it shows so much more information. But the problem is it just costs so much. If it was only like $200, it'd be like, oh, everybody would get those every year because it's just so expensive and so powerful. But the cost has always been so high, historically.
Well, my experience, here's what I did. So I went there. I booked an appointment and I went in to see how it was. In the entry, so I did do a post from the spa that showed
okay.
your location and everything. And I need to get your information. We'll share it on the show today. But I went into his location, Martha. It's beautiful, calming. You can get coffee. You
It's
can
like
get
a
some
spa
water.
or coffee shop rather than a
Yeah.
medical
Yeah, it's
facility.
very nice just to come in. It kind of lets your guard down if you have any concerns. And then he personally came out, brought me into the dressing area. You kind of go through all the information, take your
wallet, keys off, your
put
belt.
it all
yeah,
in the
you're good.
locker. Put your I called it the 1970s gym outfit. Remember when you had to dress out for gym?
Yeah, yeah.
It was one of those.
Yeah,
It
see,
was
oh,
very
that's right, you had that.
it was very
A lot of people wear their
comfortable.
own clothes, but I occasionally have metal embroidered in their blouse.
Yes,
or something.
yes.
But most of the time, we have people who just wear their own clothes.
Yeah, I put on the gym outfit because it was
Yeah, it's
just
cool.
cool.
It is free. Yeah.
I came sliding back into his area in my
Hello, she said.
I'm like in my shorts and my little gym outfit. But anyway, we just went over some personal information, and he took me in and got me into the machine. I was able to put the headphones on and listen to music while I was in there, and it was 45 minutes or
Yeah,
so.
somewhere in an hour,
I did head to abdomen.
or to pelvis, yeah, all the way
The
through.
pelvis, yeah. And it really gave me, and not only, this is what was so interesting, not only did all that occur, I was out of there within an hour's time, but by that night, he had sent me I was able to leave with,
The disc, yeah,
The
that has
disc.
images on it, yeah.
yeah, I had the disc in my hand.
And they bring it to their doctor in case you go see your doctor. Just
Yeah.
hand it to them and they can import the images.
But he then sent me the digital version that in a text that I could click and I could watch with my husband, and it was him reading.
Oh yeah, so that's one of their big innovation. And I'm kind of
Yes.
excited about this. So we're the
Yes.
only place in the whole world, literally the whole world, that does a video report. So radiologists normally again are in a dark room and they have hundreds of cases to read and they go as fast as they can from one to the next all day long. And so they don't do videos, they just read really quickly. And so we offer a video report. So once we
It's
dictate
incredible.
and you get the words, a lot of times people don't know what they mean. They'll read and say, what is a peripheral rim tear in the outer meniscus or something? They don't know
Right.
if that's good or bad or what's the significance. And so since patients don't have a doctor order, a lot of people come in on their own. We thought it'd be nice to offer a video report you could order. And what happens is after we dictate it, we'll do a screen capture of an area and hit record, and we'll roll through the images and say, hey, here is your knee. This is your ACL, this dark thing coming down obliquely. It looks great. This is
Yeah.
your medial meniscus, this little wedge, this triangle. It fits between these two bones. It looks good. Over here in your lateral meniscus, there's a little white spot going obliquely here. This is a small tear. It contacts the undersurface. And then here's your whatever. Here's a little bit of arthritis. Here's a cartilage thinned.
I
We got to
love
go
it.
through
I
all
got
that
a lot of
stuff.
that
Yeah.
arthritis.
Yeah. And so people, when they get that, they have a really full understanding because they see their meniscus. They hear the radiologist's voice talk about it, have the arrow pointing to it. And when you go see your doctor later, you're fully informed.
Right.
Instead of
And
just
look at the
wondering what
time.
yeah.
The time saved for somebody who actually does have a tear
Yeah.
and needs something
Yeah.
managed, they can take that right to their
And sometimes
orthopedic.
people have no problems or the problems are minimal. Like there's a mild bone bruise here and that's why you're hurting. Or you have a little fogginess of your meniscus, contusion, but it's not a tear. It's not going to require surgery.
There
And
you
then
go.
people know that, wait, I don't even go to the doctor at all. I came in, got my scan. I know why I'm hurt. and I know that it's not too bad, so I'm not even going to bother going to the
I love
orthopedic
it.
surgeon because they're not going to do anything, for me. But on the other hand, if they do have something, we'll say, oh, this is a bad finding. Your ACL is completely torn. You got to go to an orthopedic surgeon to get advice as to what they would recommend for your age and all that. So we kind of put you in the category of normal and, take it easy, or, ooh, you got to go see someone.
Right.
Yeah.
Right. That's
Yeah.
great.
I think all orthopedic surgeons and a lot of these doctors should be giving their patients the option to go straight to you or go through let's go through your insurance. You can do this. They should have the option, right? Because where this is concerned, if they really need to get something done in a timely manner, it's more likely to happen if they just go to you. Because today's world, right? You're jumping through so many hoops. The doctors are jumping through hoops with insurance.
Their doctors are getting killed by
And
insurance.
they're being told they're on peer-to-peer conversations when it's not actually a peer. It's a dermatologist, and they're talking to a different doctor that's never had any
experience in
contact.
that.
Yeah.
So some orthopedic surgeons do tell their patients, get the MRI first and come to me with the MRI in hand. Then we can treat you or give you advice right then. We won't waste a whole nother visit. Because what happens, you go to the doctor, of course, and the doctor says, oh, great to meet you. I don't know what's going on. Your knee is swollen. You got pain. I have no idea. The x-ray is normal, of course. And so you have to go get an MRI, and then they send you to usually their own place or the hospital. It can take 2 weeks to get in.
Yeah.
And once you get in, you pay this huge amount of money, and then you have to get the results. But the results don't go to you. They go to your doctor.
Right.
So now you have to have another visit to the doctor 2 weeks later. You get it. Now you have 3 visits multiple times, and now it's a month later.
All this time.
Whereas you could just come in that day, get the exam that day, and if you want a stat, we'll read it in less than 90 minutes. So like 30 minutes, you have the results like immediately. And so it saves lots of time. And if there's something wrong, you can go to the orthopedic surgeon, really quickly.
So how busy are you?
It depends. Today we're pretty busy. Yesterday's pretty busy. Other days we're not busy at all. We'll have, just 2 on some days. Sometimes we'll have 12, 14 on, but just wildly up and down.
Yes.
So we have bad weeks, where we're doing hardly any business. And I'm crying my eyes out. And then,
I know.
And then
I know.
another week we're like, hey, we're going to make it. We got a lot of business. So it's really variable. And I have multiple centers. I have 4 in the greater Atlanta area, and then 2 in Texas and 1 in Colorado. And they all
good for
kind
you.
of do differently. Some of them are doing great, some terrible. So
Yeah.
all over the map. So
Well,
I hadn't caught on quite
love
yet.
it. My goal is to help him build a consistent practice here in Gainesville for him. So I'm trying to get my massage therapists excited about this, because a lot of people come to us because they've got a pain in their back, a pain in their knee, a pain in their hip, or pain in their neck, and that isn't their husband or right. But so they come to the spa for pain relief, but it's a great thing to be able to recommend.
Just to know there's nothing going on, that the spa is the right thing to do. Because if you do have a problem, I have had a couple patients.
Right.
One of them was my own employee. She came in. She had really bad pain in her chest in the front, and she didn't know why. And so she came in, and she had a fracture. She had reached over funny and twisted just right, and she had a little rib fracture, but it was so bad, and she didn't know if it was a cancer or some other weird thing. But she just was glad to know that it wasn't, she's not crazy, and that it's a fracture that she does not need to have surgery on or whatever. And just the peace of mind knowing, okay, I know what it is. I don't have to do anything except take ibuprofen, and life can go on. And just the peace of mind and knowing what it is really helpful. And then my wife came in for a similar complaint, and hers was completely normal. So she's like, well, that's weird. I have all this pain.
What is
but
it?
It's not a tumor. Not an infection.
You ruled out stuff.
The muscles were fine. So we're like, well, we don't know what it is, but we know you don't need to go have surgery. You know that you can worry about your bills and your kids and stuff. You don't have to worry about this anymore, because that's good. So it just helps.
What kinds of, as it relates to heart and lung issues, how effective and what does it find or could find?
Yeah, so MRI is not very good for the heart. That's one of the lousy things. Cardiovascular disease is one of the worst things. It's going to kill you someday possibly, and people want to know about that.
Right.
But MRI for the heart is not very good. You have to have really special sequences, and usually it's a 3 Tesla scanner with IV contrast. These long, complicated ones.
Right.
Insurance doesn't pay for those very much. So we don't even do the heart at all. We see the size of the heart. We'll see the overall size.
We can see
we'll
mine.
see the chambers if one's dilated. We'll see the aorta to see if you have an aortic aneurysm. But we don't see any of the really fine details of, do you have a tiny little valvular defect, do you have any regurgitation or whatever. But we would see if you had aortic stenosis and you had a dilated ascending aorta, would see if there's a thoracic aortic aneurysm, but we don't see the myocardial function like you'd see on an echo.
The one where you're doing the contrast and all the.
But we do see vascular. So we do MRAs of the head and neck, and we'll see the carotid artery. You see the blood vessels to see if you have any atherosclerotic plaque inside the brain. So we do see the blood vessels very good, but we just don't see the cardiac function. Very good.
I want to go do that one.
And the other thing we do not see, which is terrible, is the coronary arteries. Coronary artery disease is something that's very it's a killer. And you really can't see them. They're very tiny and the heart's beating really fast.
Yes.
And MRI just can't do that. So MRI is great for like the brain where you hold still.
Yeah.
Or when we do the chest, hold your breath. We take images while you're holding your breath and it freezes the motion, but the heart is just going like crazy. So
you don't want the heart to stop.
So you have to do really fast scans where it takes a scan just really quickly just for that
It was a little interactive.
Yeah.
So when I was laying in there, you would hear the computer tell you, take a deep breath. Hold,
and it would scan and then it would freeze the motion. Yeah.
And, I was just thrilled personally to be able to listen to his reading and to watch it that night,
See inside your body is kind of cool to see in your body. Like, wow, I know what my liver looks like. Wow.
And he was very
my
sweet too.
Cool.
You don't get that. Like, look at this brain. You got a great brain.
Look at this pituitary gland. It's beautiful.
Yeah. Exactly.
So I'm sure that with the fact you have locations all over and they have hospitals near those locations, do you find that the doctors will recommend going to your facility and that is there like a group of doctors that are better at that than others, or they're more open? Do you have to go meet with the doctors to try to let them know that you're there, kind of like the way the old days of drug reps came?
I used to do that a lot. Olden days. Yeah. So we have not reached out to doctors very well at all because most doctors are part of hospital systems or they have their own scanners. Or
they're employees now.
Yeah,
it's true. And they're all employees. Yeah. So things have changed a lot. So we've pretty much given up on even going to the doctor because they're already,
That's too bad.
And, our patients are the people who tell the doctors about us. So that you'll get a scan, you have an ACL tear and you'll bring it to the doctor and you'll tell the doctor, hey, I had this
That's
over
your
here.
marketing.
Yeah, so they literally have become our marketers to patients, and the doctor's like, wow. And like, I got it today, and it was only this much. I got the results within like an hour and a half. Right. And the doctor's like, wow, it takes, 3 weeks to get on our scanner, and then another week to get the results. So they learn about through the patients. So they've been our marketers, So we don't reach out to them anymore. And plus we do such a small amount, we just do MRI without contrast. And so it's such a tiny sliver. Lane. Yeah. When I used to market for like the imaging center in town here, we did ultrasound, CT, MRI with and without contrast, all insurances, Medicare. So we did so much. We could go to like your husband and say, hey, here's what we offer, all these things. And he might use us for all his imaging.
And also, how about lung function? How good is it with that?
So it's not for lung function, but it's good for the lung anatomy. So we do see if you have a pneumonia, a pulmonary nodule, lymphadenopathy. We see the tracheobronchial tree.
Yeah,
to see
I
if
think
there's
you picked up some fluid still in my right lung from the virus that I had.
So we do see pretty good details, not quite as good as CT. CT is better than that. So CT can see really fine detail in the lungs. So MRI is pretty much better than CT for everything except the lungs.
Well, because the lungs are so really hard to see. I mean,
it's just air and there's little tiny septations
and there's also not very many pain sensors in the lungs. So if you're feeling something, you're in bad shape.
Right. By the time you get to that point.
So I have three of my mother, father, and my sister died of lung cancer.
Oh, really? So,
adenocell carcinoma.
Okay.
And which is the kind not from smoking. And so I remember going into to Clifton Hastings, and just saying, okay, what do I need to do here? And so even before, my insurance did pay for it. I don't know how he coded it.
Yeah, he must
because this was before.
This was before.
This was before
the magic
so
code.
I went in. So I went in and got a CTA, and he does that about now every 2 years, just to kind of look at that. And I do have a little bit of an enlarged descending aorta, but it's stayed the same size for like 10 years. And so it's like 1 millimeter outside the normal. And that could be a lot of things. That could be how it's measured. you know,
Yeah,
people
sometimes
are,
it comes out sideways. You remember that's not
sometimes,
tangentially.
yes. So he's terrific, but I love these kind of tests. I mean, whether it's
too.
MRI,
I do
CT,
too.
they're not invasive.
It's unbelievable.
They're
I mean,
even
truly,
with
it's incredible. To see
contrast,
inside the body is a miracle.
Yeah.
It is. It is.
People kind of don't like the contrast, but I'm like, hey,
Like that
you can
warm
see
feeling.
more. Why
Yeah.
not? I mean, I know you don't do contrast, but I think they're great tools,
They
you know,
are, Martha.
because in the real old days, they just had to cut you open for everything, and there's all kinds of problems with that.
yeah,
So
Such a huge change. Yeah, and,
I
and
mean,
even in
with-
the brain, if you had a brain tumor, you didn't know, really.
Yeah.
Or they would put air inside and see if they could see the air on an X-ray. If your brain's pushed right to the left,
my
of course, at that
gosh.
time would be, you'd be so far gone, it would be almost useless
absolutely,
information.
yeah, absolutely.
Yeah,
So I think it's fantastic because it seems like when Open MRI before it got bought by Northside, it was kind of like that.
So I
what
used to,
you're doing.
So this brings us around to, I wanted to mention this actually.
Oh,
So
good.
when I left
You
the
did
hospital,
good.
I went away and I came back and worked for Open MRI there with Dr. Michael Luckett.
Yes.
Yeah, good guy. And so he ran with your husband's crowd too, and so
Yes,
introduced me to him.
the
and
old
stuff.
guys.
Yeah, the old
The
guard,
old
yeah.
school.
So I felt
Old
like part
school.
of the old guard there, actually, good people. So I worked for them. Then they got bought out by Northside Hospital, which is a great hospital.
Yeah.
But when they got bought out, the prices jumped. It was $600 for an MRI, and they did a really good job. They had good
Right.
radiologists.
Yeah.
They had good equipment and did excellent work. But when they got purchased, their scans went from $600 for an MRI to like $2,400 for an MRI. The next day, the same radiologist reading it and everything. And after that happened, I thought, this is the time is finally right to go into my own
It
business.
pushed you right on out.
That was the thing that changed it. Before that, I was pretty happy. Like, hey, this is pretty good.
Well, that's because you're a righteous. He's
Yeah.
a good
Yeah.
person that says, "Look, I'm going to do the right thing because it's the right thing to do."
Well,
and,
and
then you
I
see that it's
Lynn used Open MRI a lot with his patients until that buyout.
Yeah.
You know, and it's
greed.
Well, and it's a big hospital system. I mean, they
Still
bought
greed.
the diagnostic clinic too. I mean, they're going to come. I mean, the Northside Hospital's coming to this
And
region
you
at
can't
some
blame
point
them.
in
They want to
time.
do it, and they want
Yeah,
to
I mean,
price as high as possible to
Yes.
support the ERs. And
Yeah.
everything. Don't blame
I mean,
them
it
at
all costs money.
But the problem is
but,
that the
yeah.
patient has lost their power. All of a sudden, you got to pay 4 times as much.
Right.
So we're the ones who are having the trouble. So again, at First Look MRI is called power to the patient. What can we do to give the patient
I love
control
that.
of their
Power
health,
to the patient.
fast services with a low, affordable price, and you don't have to ask permission. So if you want something, you can get it. You're not like stuck.
That's just so empowering. I mean, it just kind of takes a little bit of the weight off, I think. People who are
That's what
like my
medicine should be.
daughter, I'm going to send my oldest daughter, Frankie, to see you because she's been suffering with migraines for many, many years, you know, and, is it this? Is it that? They really don't know.
Yeah.
But it would put some peace in her
Yeah, we've
to
all,
be able to
one
get
of
a
our-
scan just to see what's going on.
We see patients every day for that complaint of
Mhm.
headaches. And most of the time, it's normal or near normal. A lot of times people have little white matter specks that are known to be associated with migraine headaches, but nothing worrisome. And we just give them peace of mind. Like, okay, you have migraines. You have these little white matter lesions associated with migraine headaches. You don't have to panic. And these will probably be the same for
There
the
you
next
go.
10 years. Everything's cool. Just see your doctor. And occasionally we find some bad things that need to
Yeah.
be fixed,
Well,
or, Chiari malformations. They can have surgery and the headaches go away, or sinus disease is causing the problems, or other things. So
I was just saying sinus in
Right.
this area,
Yeah.
it's a lot of times it's probably sinus.
Yeah.
Because of all the stuff that's here. Although I lived in Florida for a year before Lynn and I got married, and it was like my worst experience with sinus headaches because something was blooming
reacting
all the
to
time,
everything.
and I had sinus headaches
Something was
all year
happening,
round.
yeah.
So I was like, I need to go somewhere where things go dormant for a while.
Well, he could see from what was interesting in the scan is that he could see. I told him I had actually canceled the first appointment I had because I was not feeling well. And, he could see that I actually was sick. I called out sick and it was real.
yeah, she has some lung disease, a little bit
I had
residual
some-
stuff hanging on.
I had some fluid in my right lung and I had this left sinus cavity, just
Sucked
solid.
in, yeah.
It was solid. I hope it's better now, but
Hopefully it's completely gone.
I know, but it was good to see. It was good to see that, okay, this is residual from this virus that
and it's
I had.
not something else that we find.
That's right.
We
That's
see all the time people have big pituitary tumors causing their headaches, or I had another man who had a big benign tumor in this frontal part of his brain. It was pushing on the brain, and
A lot of
just all
benign
the time.
tumors are
Yeah.
happening
Or
right
even
now.
malignant tumors, we see those on occasion too.
Yeah.
So if somebody's listening to this and they're thinking, this might be something I want to do, what's the process and where would they go?
They just go online to firstlookmri.com
Yes.
and then they click book now, and then it asks for their information.
And do you have all your facilities listed on that website?
Correct, yeah.
So
you choose your
depending on where you live.
first ask
Mention
your
the state again. Mention
we
where
have,
they are.
We have 4 in Georgia. We have
Okay.
Brazelton, Gainesville, Brookhaven, and Alpharetta.
Okay.
And then in Texas, we have Dallas, area Plano, and then Fort Worth, a place called Alliance, north of Fort Worth. And the last one is in Colorado, Denver, Colorado, south,
Oh,
a little bit
good.
south of the downtown area.
All right.
And so
That's
4 of
good
them,
to know.
and they can just go online and click book now and ask for your name, your date of birth, and some
Right.
information, and ask what do you want to have done, like a knee or shoulder or a
Love
whole
it.
body scan, whatever it is. And then it takes a deposit, like $50 deposit for if you have one body part, just to make sure you show up. And if you
Yeah.
don't show up,
Gotta
you lose
have some
$50.
skin in the game.
Yeah, no, I have no problem with that.
Yeah.
Yeah, that sounds
And
full
the-
body scan.
and the
That
full
sounds
body
good
is
to
good.
me.
You should do it.
Yeah.
You should do it. It was
And then
it was
you come in
pleasant.
on the day and you get it done. And then when you leave, you get the disc, and the results come within 24 hours. Usually it's 3 hours, 1 hour, 4
Oh, I
hours.
had
like
it that
real
night.
quick. Yeah.
I mean, it was amazing. Then I could send it to Dr. Mickey. I sent it to Stratton. My husband got to view it with me. I'll have to let you see how he did that, because it really is very educational. Like he went through all
I do love
everything.
the videos. We're the only people in the world that does the video, and I'm so passionate about that. I used to, back in the olden days when I worked for the open MRI place, MedQuest, I used to give videos to doctors. Like your husband would have an interesting case, and it's so hard to, he's got this thing at this level. It's hard to describe. So I would just do a screen capture and make a video, and then I would just email it to him.
So you're like a techie
So
guy, aren't you?
I was doing that already
Sounds like
anyway,
it.
and I really like doing that because it just gives you so much more information to see with
It
your
was-
own
it
eyes.
was
And here's
great.
what I'm talking about. And so
Yeah.
I would do that. And when I opened the imaging center, I thought, I'll use the same technology,
I love
kind of
it.
integrate it into the practice.
So do you see this as, because you said you specialized in MRI when you were at the hospital, is that the way, because I think that, our population has grown so much and we have a shortage of doctors, but our spots in medical school haven't grown to keep up with it. And I know we do have the best medical education in the world. It's just no doubt. I mean, that's why when doctors come from other countries, they generally can't step right into being a doctor. They have to get more training and things
Right.
like that. So if someone were thinking, wow, that's something I might want to do, would it be the same traditional path education-wise? And then would they go in, because they don't teach you about the business side
Right.
of medicine in medical
you
school.
learn nothing about
So,
that at all.
yeah,
I mean, there's not much of a need nowadays because you're always part of some big system.
That's right. That's right. But there are people, and we need people like you
We do.
I
that
think
are
about
that
that.
are
So much.
individuals.
There's no innovation anymore. Back in the old days, like when your husband was back in this
Right.
prime, back with Dr. Luckett and all the people, Dr. Bachavano's father, Sherry,
Wow.
Dr.
father,
Owens.
Dr. Roger Owens. Yeah. So that crowd, lots of people had their own independent
PK
centers.
Dixon.
Yeah, PK Dixon.
Oh my
Yeah,
God,
wow.
PK was such
So
an
a lot of
innovator.
people trying to do different things, lots of innovation going on. Then the big hospitals started buying up practices.
Right.
Medicine became so hard to practice because it's so complicated with all the insurance rules, and keeping
I
up
mean,
to date
it's
with everything.
expensive
So
too.
people just
for
sold
the-
their practices,
for them.
and now everything's consolidated. There's very few people
mean,
out there.
There were things into PK Dixon's 60s that my husband would only send to him because he had done so many of them that
Wow.
he knew, and he was still great. And PK knew when it was time to go. Do you know what I mean? Nobody told PK, okay, you don't have it anymore. He was like, okay, I don't have it anymore. You know what I mean? And that was just, he was something. I
That's
remember
amazing.
the first time I met him was at a Medical Alliance, Medical Society meeting, they called it back then. And he gets up, and this was like around 1992 when we first moved here, Lynn moved back here, I moved here. And he goes, I'm a rich old doctor. Why can't I pay my own way if I want to?
Right.
And
That's
I still
awesome.
remember
Yeah.
that, and
Yeah.
that's kind of what you're doing.
Yeah,
Pay
I'm like,
your
why-
own
why
way.
can't you have-
Why
yeah.
can't you pay your own way if you want it? If you want this test, we
you
were on
should
the
do it.
Yeah,
we were
well,
on the phone
who's
with
the insurance company said, no, you're not allowed to. I was like, what? Who are you to tell me what I can
Well,
do with my
that's-
body? Yeah.
yeah.
Well, and we were on the phone with our friends from England because our friend has had this gut problem for like 4 weeks, and where he lives in Southampton, which is a pretty big town,
Right.
they don't have any regular doctors anymore there. All of them are locum tenens, and which is temporary doctors, and you do everything by email or
Wow.
technical request. And this guy, and my husband was on the phone with him, and he's like, "You've been having these problems for 4 weeks,
Yeah.
and they've done nothing but a CBC." He was having these gut problems where everything was making him sick, and all this kind of stuff. So Lynn wrote up this whole thing. You need to ask about this and about this, about this, and don't tell him I'm an American doctor, but just go in and ask for it,
Right.
because but they still had to do it digitally. So with all our problems,
Right.
we still have the best healthcare system in the world.
We have access to
We
the
have
greatest minds.
Problems with
there you go.
insurance,
In the room
problems
included.
with all the things, but we still have, as far as if you've got a problem or you need to find something out, we've got the best.
Yep. Great equipment, great people.
But I think this is just my, USA, like looking into the future as I do sometimes. I feel like what you are doing, the innovation that you have made, will help our population if we make the right choices to use this. It will then
Grow and expand.
grow.
and
Other
more
people are going to do
innovation,
it. And that will then put insurance under some pressure where they have been the guard at the gate to our health over the last 20 years.
Yeah.
And they've grown into a monster who are even now telling the doctors how to do their job.
Mm-hmm.
And
the
no
doctors
one
have really lost their power. Yeah, my
no
wife,
one likes that. So I think that we're seeing the tip to the change that we need in this country to take the controls back, put them in the hands of the medical practitioners.
Oh,
And
amen.
the
Right?
patients, there's
And in the individuals, and put the insurance companies back in their proper place. But but it's going to take money, and it's going to take that people funneling their own money through their own choices into practices like yours, which will then put them in a different position.
No, I think you're right. And then
You know.
I think the foundation of that is making the right choices, though,
Yes.
every day related to what you
Personally.
eat and drink and
Yes.
where it all
move.
starts. Yeah.
Eating and
Yes.
drinking and moving is really, if you don't do that right. I mean, Lynn used to
That's
say,
the TMI foundation.
I know. I mean,
Eat,
Lynn,
drink, move.
So Lynn used to say, if people quit drinking, smoking, and started eating right, I'd have nothing to do.
Thank
Yeah,
God
and
for our
that's,
habits, yeah.
this
Which
is
is
a
not a bad
wellness
thing.
podcast, and wellness does include, that's where I love what we're doing, because wellness includes medical doctors. It can include holistic health spas like I own. It can include functional medicine doctors, all of it.
Right.
I think foods,
Right.
People eat
Absolutely.
It needs to all be under wellness and not separate as, at one time it was like woo-woo medicine and then modern medical, medicine, Western medicine. Traditional medicine is the ancient beginning practices of how they healed people back before we started getting involved in the more pharmaceutical end of things. So is there not a balance between the two? I think there is.
I think there is too.
And I think we're going to find it at some
I hope
point.
so.
We're
I
on
hope
the
so.
way.
too. So, Dr. Brian Gay, tell folks one more time how they can access your practice.
Okay, they can go online to firstlookmri.com and learn about the practice. And then if you'd like to book a scan, you click book now. And then it's very easy to put in your name and choose a time and then come on and get a scan. So very, very simple. There's no barriers at all.
Well, thank you for being with us today.
Yes.
It's always great to be with you and talk about the issues that we talk about every single week. We want you to be a part of this community and like and subscribe the podcast if you're watching us on YouTube. Put in the comments what you think about what we talked about today and maybe what you'd like us to talk about in the future. So we appreciate you being with us today.
And as you all know, Martha and I, we just cherish the time we get to spend with people like Dr. Brian Gay.
Thank you for having me here. This has been great.
Being able to bring him to you all. And I hope you do move on these things and learn from what we're saying, because Martha and I know that your wellness deserves a little oversharing.